Hello, everybody. Thank you for tuning in with Elder Elite. I'm Julian. Today, we are so happy to have Dr. Angel here with us. Hello, Dr. Angel.
Hi, everyone.
Well, so before moving forward to our topic of discussion of the day, let me do some brief introduction about Dr. Angel. So Dr. Angel is a general physician and year 2 of geriatric fellow. Graduated with first class honors in MBBS at Monash University, Australia. Dr. Angel then continued her studies at membership of the Royal Colleges of Physicians, which is MRCP in the UK. And then in 2020, she started geriatric subspecialty program with the Ministry of Health Malaysia. So with her past participation in related conferences, workshops, and also experiences in the related field, we are very pleased to have Dr. Angel here today with us to share her knowledge about geriatrics. So thank you so much, Dr. Angel, for joining us today. All right, so today we're going to talk about introduction about geriatrics. So I think people are more familiar with paediatric medicine, which is more dealing with the children. So people might be wondering, what is actually geriatric?
This concept of, thanks Julian for the question. This concept of geriatric medicine is not new. But in Malaysia, it's relatively new, sort of started around about when in the 1990s or so. But before this, in the UK, in Australia, people already aging there. So they realized that, older people, they are very heterogeneous and you cannot just treat them by age. That's when the whole concept of geriatric medicine about. So it's about caring for the older person, so to say. In Chinese, we call it 老人学. Yeah.
So is there like a age group between, like, we classify them as geriatric under geriatric care?
Yeah, traditionally speaking, we say people older than 65 should go under the care of geriatric medicine specialists. But if you look at that, right, as I said again, they're very heterogeneous. You may have 40, 50-year-old who's we talk about physiological, also biological age, right? So their physiological age, right, but be so much more older compared to a very simple example, the very classic one, I always say, Dr. Mahathir. You see, he's still so fit. So you cannot really when you say age, right? We're not trying to be ageist here. So sometimes when you classify by age is a little bit difficult, but so sometimes we do see a little bit of younger people, depending on the situation.
I see. Okay, so because I feel it's lack of geriatric care in Malaysia, so what are the importance of geriatric care in specific?
Yeah, the whole subspecialty of geriatrics came about quite recently, as you correctly point out, Juan. But it is very important. Why? Because what we do in geriatrics is what we call a comprehensive geriatric assessment. So we don't just go through the person's medical history, how many medical problems they have, the medications they have, but we also look into how the disease actually interact, the kind of complications, and we also bring in other factors like how robust the older person is, and whether you should be as strict when you treat them, or you should be less stringent, depending on certain factors like their frailty status, and also whether they have problems with their cognition as well. And also other things you have to take into consideration is social support, especially if the person are not able to care for themselves. So this is when geriatrics come in. We identify all these problems, so to say problems, and we try to come up with individualized solutions for all the patients. And of course, geriatric itself is not just about the doctor. The doctor is a very small part of the team. We always work in a multidisciplinary team. That's the beauty of it. Because you cannot do it alone. Just so many things to assess. So that's why we always have our physiotherapists, occupational therapists, dietitian, social worker, all these people are very important. Sometimes, dentist also very important as well. Recently,
even like
the routine.
optometrists, I think so too, right?
Yes, definitely. Visual impairment and ENT specialists, hearing problems are also very, very common in the elderly.
Yes, exactly. So it's like a group of professional working together. So not just the geriatrician personnel alone who works with the elderly only. So it's basically a professional group that works together.
Yes, you're right.
Okay. Yeah, but then as we mentioned, like we need a few professionals that working together. So are there any issues or challenges in geriatric care, especially in Malaysia context?
Yeah, definitely. To begin with, older people are already often very complex. So sometimes it's no, it's not very textbook based, when we used to study in medicine, right? It's either, let's say you got fever, you just give fever medicine. It's not as simple as that. Yeah. Especially, in an older person, when they come to you with an infection, they may not even have fever. They might just come to you, feeling a little bit more tired than usual, or they come to you being confused. So these are, very non-specific sort of presentation. Remind me what is the question again?
Okay, I feel like I think the challenges is more like maybe the older people tend to be couldn't express themselves quite clearly. So sometimes they are more affected with their mental health as well. So they kind of feel pek-cek or what, then they started to be frustrated and they don't want to talk about it. So is it one of the challenges that faced by the geriatrician as well?
Yes, definitely. Taking a history itself can be very, very difficult because of many reasons. Your average 80-year-old, they might not be able to see very well. They might not be able to hear you. Even they have a hearing aid, they might not want to wear their hearing aid. So it can be very challenging. And especially for those who have memory problems, they tend to tell you stories of the past, but they may not remember exactly what happened that brought them to the hospital. So that's when a very reliable history from a caregiver is very important. But we always be a little bit careful when you take a history from a third party kind of thing, you see. They might not reflect truly, because when they tell a story, they've already put in their own perception as well. That's from the patient's perspective. But I mean, as a society in general, because our population is aging really rapidly, people just don't realize how much burden and this has actually caused in our society. And I think the whole concept of healthy aging and also aging in place is not really that deeply rooted in Malaysia. And a lot of our older people and our community just think, already it's okay lah. They're not going to be as fit, as healthy. Actually, this is wrong. You can still be very healthy and very fit even though as you are aging. So I think these are
like
the sort of
Dr.
barriers. Yes. We always bring the most classic example.
Yes. So as you mentioned, because people tend to be like 老人学是不重要, like we don't need to care about these older people, like we don't need to have like special care for them. So with the Malaysia's fast-paced aging population, if there's no enough of geriatric specialists in Malaysia, what are the consequences in that situation?
Yeah, honestly, at this rate, the number of geriatricians that we are churning out from the healthcare system is never going to be enough to care for our elderly population. That's a fact. So that's why it's also very important. As geriatrician, what we do is we educate all the other specialty around us, tell them, how we should actually manage the older person. So you can actually see in the hospital setting, for example, we have a lot of collaboration. For example, with the orthopedic surgeons, because you see a lot of older people, they come in fall, and because they have osteoporosis, bone very brittle, so they might have broken their hip or broken their wrist, for example. So that's when the whole concept of the geriatrician working together, look into things like falls prevention, a little bit of rehabilitation, also starting medication, and also investigate for the reason for the bone fragility to prevent another fall and further injury. Yeah.
So it's more like 全方面, like from head to toe, inside, outside, everything about the elderly. We have to take care of them.
Yes, to know how to care for an elderly person, you don't just need to know the disease that they have. You have to know the person. Because you know they've lived with their preferences and values for so long. And when you try to impose your value on them, they might not believe in you, because most of us are younger than them, right? Yeah, so it's not necessarily wrong that they don't believe in you, but you just have to sit together, and devise a plan for them that, you try to convince that this is good for them.
Yeah, and also they need longer period of time to adapt to new things, like new solutions. They need time, and also we need some more patience to convince them, in the sense of like they need to take this medicine or this solution like that. So well, be it like authorities or even public as us, what can we do, like if there's really lack of geriatrician in the society?
Yeah,
like
I think the WHO has rightly declared the decade of healthy aging for the next 10 years or so. So you see worldwide, what they do is they are trying to create more age-friendly communities. So I suppose we have to think of, for example, building itself. What you can do to make it a little bit safer for older people to reduce their risk of falling. And for example, if they have visual impairment, and how you should actually design your space with contrasting colors, things like that, that are actually easily identifiable to make the environment safer for the person. So these are the sort of considerations that we can do as a society. And also other places, make it more friendly for older people, the parks, where they can exercise, make it safe for them, this kind of thing. And also other things that we is one very interesting cafe in Melbourne, Australia. They've actually opened a cafe for people who have dementia. So it's very interesting that they have a lot of group activities to stimulate the mind, keep them active. So yeah, social connectedness.
That's interesting.
Actually, yeah, social connectedness in older people is actually a very, very important thing. Yeah, because a lot of older people, I mean, as you age, right? Unfortunately, sometimes your partner might pass on, your children may not be with you, they're very busy, they have their work, they have other children to take care as well. Often outstation, and now, MCO, you still cannot travel.
They can't come back. Yes.
So they're very lonely. So, when they cannot be with their family, so as a community, we need to create this kind of social connectedness and, make sure they participate in activities, include them, basically. Yeah.
So like try to occupy the time of the elderly, so they have something to hope on, they have some interest to work out, so at least they won't feel like they are useless. They at least because like I think socially active would actually influence their mental health very much, and tend to be more, they can be more physically healthy as well, right?
Definitely. I mean, for example, let's take eating, for example. If you eat alone, right, you tend to be like, just eat, sandwich or whatever.
Yeah.
But yeah, when you are
then fine.
Exactly. And that's why a lot of older people, what they survive with tea and bread and cookies, all those things are actually, in the long term, they don't have much nutrients. So a lot of them are actually malnourished. So, but if you put eating, as a very socially pleasant activity, actually have a group of people eating together, preparing food, you tend to pay a lot more attention to what you eat as well, because you want to impress other people as well. So that makes the whole thing a lot more fun, and indirectly actually makes people more healthy. Yeah.
That's good. Okay, so since we are in the page of this, what are the advices that you, as a geriatric specialist, that you could advise to people who take care of the elderly? Because like I believe a lot of people, we do have our parents or maybe grandfather, grandmother that are more elderly. They need to take care of them. Is there any simple advices that you could bring out to us?
Yeah, number one is spend more time with them whenever you can. As we said before, companionship is very important. Once you have the right mindset, it's a lot easier to adopt sort of health related behaviors. And actually, a healthy lifestyle is pretty much the same whether you are young or old. But we tend to neglect it a little bit when we get older. You might get a lot of older people, they often come to me, I'm so old already. I do not need to eat as much. Because I only have, that much time left. I should give the good food to my children, to my grandchildren. No, actually, this kind of thinking is very wrong. It's wrong.
Yeah.
Everybody should eat healthily. Their balanced diet is as important. Actually, it's even more important when you get older. That's because as you age, our organs degenerate, and also that includes our muscles. So if you don't eat enough protein, you cannot build enough muscle. Eventually,
you don't have energy.
Yes, you don't have energy, and you don't have enough muscles also. You're not going to become weaker, just weaker in general. So that's what we call when a person becomes more and more frail. And it's a vicious cycle. The weaker, the more tired you feel, the less likely you're going to exercise, the less likely you're going to be able to prepare food and eat healthily yourself. So everything just goes down spiral from there. So it is very important to maintain that sort of healthy lifestyle throughout our lifespan so that we don't become more and more frail as we age.
Okay, so we shouldn't have the mindset, even for the older people or even as younger people like us, we shouldn't have the mindset that old people is useless. Actually, old people are also like normal people. We are all the same. We still need to live the life on. We still need to have healthy food. We can also socially very active as well. So we shouldn't have the mindset like 老人家就是没有用. We shouldn't have this mindset.
Definitely. They can contribute so much to the society. And I remember also there is a program somewhere else in the world, can't remember exactly which country. What they do is they actually, they have a sort of daycare. They put the older person, they pair with a child, but they're not related by blood. So they pair them together. It's a lot of fun because the child, right, actually, stimulate the older person to do things, and the older person feels very happy to teach them. So they sort of keep each other company and they learn from each other. It's a fantastic program. Yeah.
That's cute. I think we should maybe organize some kind of activity in Malaysia as well. If this pandemic gets better and then people come back to like we can have like more interaction, physical interaction, I think we should organize activities like that.
Yeah, people are actually resilient, even though I suppose we might still have to live with social distancing all that for some time. But we can devise something out of it. It is not impossible. The technology we have right now, we just have to think out the box.
All right, I think that's all for today's sharing session. Thank you so much. Thank you, Dr. Angel, for this sharing today. Once again, thank you so much, Dr. Angel. All right, so hopefully our audiences could get benefits from our sharing session today. All right, so see you guys next time. Thank you and bye.
Bye, everyone. Thank you, Anne.